Hi, I'm Amanda Ralph. I'm a nurse practitioner and the owner of White Coat Aesthetics here in Las Vegas, Nevada. Okay, most of what I have discussed on this page so far has been injectables related because I am an injector. So obviously, I love Botox. Obviously, I love filler. I love Sculptra. But let's talk about some other things that we can do in the medical aesthetics world to keep us looking natural, to keep us looking beautiful and anti-aging in the best way possible. I spend so much time talking about injectables, and of course, injectables are so important. I love them, but I think it's really important to understand what else we can do in this space. So let's talk about skincare and what we can do with skincare. One, it is very important to get on a good medical grade skincare routine at home. I really do not spend enough time talking about this, and I was thinking about this recently. We all spend a lot of money on makeup and skincare at home. I know that you are spending the money. What I would say is we need to talk about the quality of the products that we are purchasing. For me personally, I spend almost no money on makeup. I am actually a very low maintenance girl when it comes to makeup. My foundation is drugstore. Most of my products are over the counter, very, very simple products. What I invest my funds into is medical grade skincare, and I really think that my skin is really looks better for the sake of it. I have people ask me all the time about my makeup, but it's not my makeup that is what is doing it. It is my skin routine at home. If your skin looks good, any makeup is going to look good on top of it. And I would say it's better to prioritize your skincare so that you can look good without the makeup on top. So, what I want you to be thinking about, I want you to be using a good retinol. I want you to be using a good sunscreen. I want you to be using some sort of antioxidant. Antioxidant like a vitamin C. There are so many antioxidants on the market. Of course, my favorite is going to be the Skin Medica line, but there's lots of options on the market. Why do we need antioxidants? This helps stop the formation of free radicals in our skin, which is damaging our skin over the years. Free radicals are formed by environmental pollution, light pollution, sun exposure, and these are going to be helping those free radicals from stopping in our skin. Antioxidants are very important. Sunscreen is important to help protect from UVA and UVB rays in our skin. And then, of course, a retinol is going to be helping our skin rejuvenate and overturn at a higher level than it normally does. On top of that, you can look into growth factors. I love the TNS Advanced Serum. You want to make sure your skin is never dry. So investing in a good moisturizer and a hyaluronic acid is very important. I don't want to go into every single thing on the market, but I just want to say, please invest in your skincare. If you are considering Botox, if you are considering filler, you need to be on a good medical grade skincare. Okay, this is all to be used at home, purchase and practice and use at home. On top of that, I want to talk to you about the treatments that I would absolutely recommend if you want to continue to anti-age well. All of the treatments I'm going to discuss today are what we use here at White Coat, and they are really, in my opinion, the gold standard of what you should be doing with your skin. What I always want to start my clients on when they come to me talking about anti-aging is building collagen. We must build collagen if we want to anti-age as naturally and as beautifully as possible. How do you build collagen in the skin? A few ways. One, that retinol I was telling you about, that helps build collagen in the skin. So please prioritize retinol. Two, microneedling in the skin. Microneedling of the skin does create collagen. And how does it work? We have an actual microneedling pen. It actually pokes the skin multiple times with these tiny needles, which is creating micro trauma to the skin. Micro trauma then helps the body say, okay, we need to build more collagen. Truthfully, the body just gets lazy when it comes to building collagen. It stops producing a percentage of collagen every single year at the age of 25. How do we want to build more collagen? We need to force the skin to create more collagen by creating these tiny little micro trauma, micro wounds to the skin. With that microneedling, we are creating the tiny wounds, which then allow for the production of collagen in the skin. It is a slow process. Collagen takes about 90 days to regenerate. We always recommend a series of 3 sessions about a month apart, but you can really see the difference in your skin and how much it glows. I've had multiple clients tell me how much more their skin glows after a microneedling treatment. So regular microneedling is a gold standard. We also carry microneedling with radiofrequency, RF microneedling. You will see this all over. It's very, very popular now. There are multiple, technologies, multiple businesses that have this kind of a technology. But RF microneedling is very important. It's the same concept of the microtrauma, but instead of the needle piercing through, ours delivers energy through these metal pins. The energy then has that radio frequency attached. It's bulk heat, which then tightens those collagen fibers and also regenerates collagen in the skin. Same exact process, about 3 months apart, 1 month apart, 3 sessions, and then you're regenerating the collagen over multiple months. And then again, Sculpture is a biostimulant injectable that we can build collagen as well. But everything I'm talking about in this video is non-injectable related. So please build collagen in the skin. This is the way of the future. This is how we're going to regenerate, looking nice and natural and beautiful. If the concern is more pigment related, if you have dark spots, melanocytes that are popping up, if you're seeing those sunspots and age-related melanocytes, then I want you to do something called IPL, which is a laser. It's an energy-based device, not technically a laser, but IPL is going to target and break up those melanocytes, which then allow the body to get rid of them. Or you can also use chemical peels. Chemical peels are pretty amazing because they are a multifactorial kind of a treatment. They can target fine lines and wrinkles. They get rid of the top few layers of skin, which can also help with pigmentation. It can just help rejuvenate the skin. So I would want you to come in and talk to one of our estheticians to see what they would recommend first, but these are options when it comes to skin discoloration. And then I just also wanted to talk about regular facials and the importance of keeping your skin healthy and moisturized. In Nevada, in Vegas, where we are located, we have a very, very, very dry climate. We are in a desert. This ages us at a much faster rate than those who live in a humid climate. And I'm always trying to explain this to my clients. If you feel dry, your skin is already desperate for fluids, okay? If you're at the point where it is actually feeling dry, then you are like way past the point you want to be. Please keep good moisturization of your skin through a hyaluronic acid, a good moisturizer. Use it frequent so that you can make sure that you are never feeling too dry. But we have an amazing facial in our practice called the Diamond Glow treatment, which is one of our most popular treatments. This is a 3-in-1 technology. It exfoliates, it extracts from the pores, and then it infuses a serum to keep the skin hydrated for 72 hours post-treatment. So when you are really trying to take care of your skin, I would recommend a Diamond Glow treatment about once a month. We do have 4 different serums attached to that, which can help you target multiple things in the skin. But these are just all ways to make sure that we are anti-aging naturally. People love Botox and they love filler, but they can get to a point where they're just kind of obsessive with trying to treat these things in my room. And I have to sit them down and say, if we don't take care of your skin, the top layer of your skin, it does not matter how much filler we place, how much Botox we use, we are not going to be looking our best. Please take care of your skin. And again, all of this is best done as a prevention than it is waiting too long to do it. So really, my patients in their 30s, I'm saying build collagen now. Don't wait until you're 65. Do it now because that's going to help you looking natural for longer. Let me know if you have any questions about some of these things that I've mentioned. I'm happy to answer or expand on any more of these in the future. Thank you so much for watching.